Happy Wednesday night, everybody. We're just reaching out to all of our followers to give you an update on Aurora and to let you know that she has a very big day ahead of her on Friday. If you don't follow us, just to give you a brief background on Aurora. Aurora came to us as a stray, dropped off by somebody. This little itty bitty pitty girl, so sweet with the distended belly. We did take her immediately to the vet, and I asked them to please check her for some puppies, and they said they didn't see any puppies, but they did feel a heart murmur, and they suggested an immediate echocardiograph. She did have that the next day, and the initial findings was that it was an MVD, mitral valve dysplasia, and this pretty much hit us really hard because there's no surgical treatment for that. You could just treat it with meds, and all it could really do is slow down the progression of congenital heart failure, but it can't really stop it. And then about a week and a half later, her foster said, I still feel like there's a possibility she could be pregnant. Her belly's getting bigger. So I said, okay, I'll bring her tomorrow. Took her back to the vet. They did the x-ray, and lo and behold, she had 6 puppies in her. At that point, they suggested we see a specialist immediately to determine whether or not she could give birth naturally or if she could actually withstand anesthesia and have a C-section. So off to a cardiac specialist, in which we thought we were just going to be finding out what the best option for delivery would be. And instead, he said he would really like to redo the echocardiograph. From what he could feel and what he could hear, he didn't really strongly feel that it was an MVD. So of course we said, do whatever it is that you think you need to do. And he did another one, and with us in the room, and said, she has PDA. This is something that could be surgically corrected. And the vet techs were cheering and clapping, and I still was a little bit confused and needed for them to catch me up to speed. And ultimately what it is after a puppy is born, it has a duct that is supposed to close off, and that allows the blood to flow the right way around the heart. And sometimes puppies' ducts don't naturally close and they stay open, and then blood gets recirculated back into the heart area and keeps flooding it, and it makes the heart work really hard to pump it all out. And ultimately it is very, very damaging, and oftentimes a death sentence if not treated. And that's what Aurora has. So the good news is, as a result of being pregnant, we were able to get the correct diagnosis, and she is able to get surgical treatment, which is amazing. Now, the downside is Aurora is an extremely expensive case. So we had her initial echocardiograph, we had her second echocardiograph, we had her fetal ultrasounds to determine the exact age of the babies so that we knew exactly when we could do a C-section. We had the C-section, which in itself was $2,172, and ultimately we were already over $3,300 in bills before even getting an estimate on the open heart surgery that she will be having on Friday. And that estimate came in today, and that estimate is for $6,707. So we definitely, Aurora needs you, we need you to help us give her the best possible treatment that she could possibly have, because she is without doubt worth it. She is by far the sweetest little girl. And she just brightens everybody's day. I encourage everybody to please hashtag Aurora NYBC, AURORA NYBC, so you can see all of her previous posts, and you can see what a sweetheart she really is. 5 girls and 1 boy who are in foster with our rockstar, amazing, just most wonderful people in the world. Jen and Jay are doing fabulous. They're porky little pigs. And we are also very blessed that Aurora has a condition that we can treat. So here's where we need you. We need you to help us help Aurora. So if you could please visit www.nybullycrew.org and click the adopt button, click the dire cases button, and find Aurora's campaign and help donate to it. That would be very, very, very much appreciated, considering bright and early Friday morning, she will be on her way for her heart surgery. And then she will stay with them Saturday, Sunday, and I will pick her back up on Monday and hopefully have some amazing news for all of you. So if you'd like to be a part of her journey and help us help her, then please donate to her cause.
Yeah. Look at his face. You're so funny.